Hi, I'm Dr. Gerke. Welcome here to this health seminar. Let's go through some slides where we can explain how you can remain healthy. The most important concept to understand is that health and disease exist in the body in a state of equilibrium. In other words, health and disease are in balance within your body, and usually health is dominant, but there are times when disease overrides. So the idea to grasp is that at all times the body will try to heal itself if it is suffering from a disease. And that's what we want to explore further tonight. So let's look at what the Clinical Journal of Nutrition said. Free radicals cause cell, tissue and organ damage. Now, what are free radicals? Well, they're highly charged molecules that you breathe in or can eat or drink. And they get into your bloodstream and they can cause damage to your cells, tissues and organs and cause disease. Now, on the other hand, antioxidants are also recognised as neutralisers or combaters of free radicals. In other words, they will neutralise the free radical highly charged atoms that are in your body. So what this really means is that you must have enough antioxidants in your body, and you must reduce the amount of free radicals attacking your body. So where do free radicals come from? Well, there's environmental pollution. Now, I've been all around the world. I've looked at many cities around the world, and I've got to tell you, it's very frightening to me the amount of pollution that is out there. That pollution is free radicals that are attacking you every time you breathe. And it gets into your food and it gets into your water. Now, strangely enough, the body also produces free radicals, particularly when you exercise excessively. So the body in its daily metabolisms will always produce free radicals. And then there are products that you can use, either taking products in or painting them on your body or using shampoos or whatever. And these products can have toxic ingredients in them, in other words, free radicals in them, and you can paint them onto your body or ingest them. And then, of course, there's the food you eat, which can have herbicides and pesticides and other forms of free radicals. So what this really means is it can be very difficult to avoid free radical damage. But then we've got a complication that in older age, the body produces far less antioxidants, and this can therefore lead to disease, and this is well known. Everyone knows that as you increase in age, you become more susceptible to disease, and this is directly proportional to the amount of free radicals that are in your body and the less number of antioxidants circulating in your bloodstream. So what actually are the problems that we're facing today? Well, the first thing is that we have many less vitamins in our modern diet due to growing conditions. Now, one of these problems is that most fruit and vegetable are now pre-picked green, not ripe, but green, and then transported to the cities and placed in the supermarkets. You say, well, why would that be? Well, let's imagine that you've got a lovely ripe tomato sitting in a field on the vine, and you pick it. It might be ideal to eat right there and then, but if you put it in a truck and transport it 1,000 kilometres to a supermarket, it's not going to look very pretty or taste very good by the time it arrives. It's going to be more like tomato sauce. So for that reason, marketers are very practical and they ask the producers of fruit and vegetable to pick their products green. And the trouble with that is that the fruit and vegetable don't get the full nutritional complement of antioxidants in them. There's also a well-acknowledged problem, and it's been known for well over 50 years, probably closer to 80 years, that the soils that we grow our fruit and vegetables in now are nutritionally deficient in trace elements. They've been depleted over the years of having fruit and vegetables grown in them. Now, that's a major issue because it doesn't matter how well you grow your fruit and vegetable, they're not going to be nutritionally effective when you eat them. And then, of course, there's the problem of genetic engineering, which helps speed up the growth of fruit and vegetable. And the trouble with that is that that doesn't allow the full nutritional content to occur in the fruit and vegetables that are genetically engineered. So for those reasons, the dietary reasons, we are not getting the full complement of antioxidants in our food anymore. But we are also exposed to an ever-increasing level of free radicals. So there's the rub. More free radicals that we're exposed to, but we're getting less antioxidants in our diet. We now have to look at personal care products, many of which have free radicals included in them with the ingredients. Many of these ingredients are potentially harmful because they have high concentrations of free radicals. For example, there's sodium lauryl sulfate, or SLS for short, or its derivative SLES. Now that's actually listed as a poison in Australia. Can you believe that? That there's an ingredient that's listed as a poison in Australia, but in India, for example, no one even knows that it's a potentially harmful ingredient. And there's another example, that many mouthwashes have high concentrations of alcohol included in them, and that's been associated with high cancer rates in the mouth. Now, I just don't understand why a health product, a mouthwash, would have an ingredient in it that would likely cause an increased rate of oral cancer. It doesn't make any sense to me. So let's look specifically at just a few of these potentially harmful ingredients. Let's look firstly at sodium lauryl sulfate or sodium lauryl sulfate, that is SLS or SLES. Have a look on any products that you buy from the supermarket and I'll bet that the majority of them have these ingredients in them. Now, sodium lauryl sulfate, SLS, is an irritant that's used in clinical trials. It's the baseline irritant used in the cosmetic industry when they test their new products. SLS can be detrimental to hair follicles, and yet, strangely enough, it's used in shampoos. Why would you use an ingredient in shampoo that can be detrimental to the hair that you're cleaning? SLS can accumulate in the body via the skin or eyes. It can denature protein. It can affect the eyes. It can damage the immune system and the skin. It can cause skin sensitization. It can have impurities in it which may or may not be carcinogenic. It can cause stomach irritation, nausea and diarrhea. Let's look at another ingredient commonly used in many personal care products, propylene glycol. This can cause contact dermatitis. It can damage membranes and cause rashes. It can retard healing of the skin. It can cause skin surface damage. It's a primary skin irritant. It can cause skin and eye irritation. It can cause nausea, headaches, vomiting and diarrhea. Let's look at formalin or formaldehyde. It can hurt or burn the eyes. It can irritate the skin. And it's a recognised carcinogen. Why would you put a recognised carcinogen in your hair care products? Let's look at mineral oil. Mineral oil can have potentially carcinogenic impurities included in it, and it can clog or suffocate the skin. So why would you put mineral oil in your skincare products? These substances are most often used in products that you would least expect to find potentially dangerous ingredients in them. Some of these products that you'll find these ingredients in are shampoos and conditioners, shower gels, toothpaste, mouthwash, bubble bath, children's shampoo, and many more products. These ingredients can be detrimental at the area of exposure, and therefore, for example, shampoos may cause dermatitis or dandruff. Again, why would you use an ingredient in a shampoo that can cause dandruff? And skincare products may cause dehydration and the appearance of premature aging. Now, generally, skincare products are meant to make you feel or look younger. So why would you want to use an ingredient that could make you look older? For these reasons, I'd encourage you to check the ingredients that you use in all the personal care products that you have in your bathroom. So what's the solution? Well, the solution is, firstly, to supplement with antioxidants. Also, to reduce your exposure to free radicals, particularly your personal care products. Watch what you eat, reduce the amount of fat and red meat that you eat, and reduce pollution. Now, in general, that's beyond most individuals' control, but you can at least lobby government and ask them to aim at reducing pollution. Let's look at what the Lancet Medical Journal reported in a clinical trial about a decade ago. They showed in the Cambridge trial that the use of antioxidants can reduce the rate of heart attack by 77%. Now, that is an enormous reduction. If that had been a pharmaceutical drug trial, then that pharmaceutical drug would have been absolutely marketed to death around the world, and people would have got a lot of money from doing that. But because it's an antioxidant which can't be patented, it got almost no press exposure at all. But the facts are there in the prestigious Lancet Medical Journal, a 77% reduction of heart attacks. But there are some important points to notice with this trial. Firstly, they use natural vitamins, not synthetic vitamins. Now, the important issue here is that pre this trial, most clinical trials that were reported were using synthetic vitamins. And not unreasonably, the trials did not show very satisfactory results as far as vitamin supplementation went. But we now know that that's because synthetic vitamins don't work very well. They're a different isomer and don't work very well on the cells. In fact, in some cases, a synthetic vitamin can actually inhibit a natural vitamin being taken up into cells. The other thing about this Lancet study is that it took 200 days for the effect to be noticed. In other words, once you started taking the antioxidants, it took 200 days before the effect of reduction of heart attacks was taken into effect. And the other thing was that they used 150% more than the recommended daily dose. So let's investigate this a little bit more. What can we actually do? Well, first of all, understand that times change. I've given this health seminar around the world, and wherever I go, I often ask the question, who in the room can remember when we used to grow our own fruit and vegetables in our own backyard, and when they were nice and ripe, we would go and pick them? And I get a very small number of people putting their hands up, and most of them are over 60 years of age, and they remember doing that about 40 years ago. Now, times change, and when I now ask, so how many of you in the room continue to do this, almost no one, including the older people, almost no one says that they do that. So none of us are getting the ripe, fresh fruit and vegetables to eat straight away. So times change. So once upon a time, the medical profession said you don't need to supplement with vitamins, minerals or antioxidants. And that may have been true 50 years ago, but not now, because our dietary intake has changed. The other thing is there's no such thing as a daily recommended dose. Now, I know that the medical profession says there is, but it doesn't make any sense. People have different metabolisms, different absorption rates, they're different sizes. Some people are really big and some people are really small, and a lot of people are in between. They have different body fats, they have different water and food intakes. What that means is there's not going to be a recommended daily dose specifically across the board for everyone. Everyone's recommended dose will be different. So for the medical profession to say that there is just one dose for vitamins and antioxidants is a nonsense. This was important when it comes to explaining the results of the Lancet trial, where they found they had to increase from the daily dose. The recommended daily dose of 150% is what they did. The next thing is that the medical profession often says that all you're doing when you take antioxidant supplements is having expensive urine. Well, I agree with that. That's exactly the case. but that's what we're trying to achieve. If you understand that we need a threshold of antioxidants in our body to combat the free radical attack, then we need the optimum, maximum threshold. And the body should determine that, not some medico who writes some script in his chair in his office. The fact is that the body, your body, is the one that should determine the maximum level of antioxidants required. So what I advocate is that we take an excess of antioxidants every day, and the body will determine what it wants and will excrete the rest. If we do that, then we're always running at the maximum threshold, and that will give us the maximum protection against free radical attack. Now, the exception to the rule here is when we're talking about fat or lipid-soluble vitamins, not water-soluble vitamins. Now, with fat-soluble vitamins, you can accumulate them in the body and it can become toxic. So I do not recommend that you take excess numbers of fat-soluble or lipid-soluble vitamins. But there are ways around that. For example, if you take beta-carotene, the precursor to vitamin A, and that is water-soluble, and the body will determine how much beta-carotene it needs, and it will excrete the rest. So let the body do what it wants. Let it determine the level of antioxidant that it requires. Let's deal now with Western medicine. Unfortunately, Western medicine is very much focused on cure, not prevention. Now, in some cases, that's obviously very necessary. If somebody has just had an acute trauma, you need to cure them in a hurry. You can't actually prevent some traumas. But there are some disease processes where it's better to prevent rather than cure. The other downfall of Western medicine is they tend to treat parts of the body, not the body as a whole. And they tend to use pharmaceutical drugs to cure the symptom, not often attack the problem. Now, I just don't agree with this. I think you've got to use antioxidant supplements to treat the whole body and to attack the cause, or should I say prevent the cause, before trouble occurs. Now, I'd now like to raise the issue of OPCs. OPCs are a special class of antioxidants, a very powerful class of antioxidants. And OPC is short for oligomeric proanthocyanidin, which is a bioflavonoid. It's a pretty big word, so we use OPCs for short. And OPCs come from pine bark and grapeseed extract. They come from other sources as well, but they're the most commercially available. But it's now found that ginkgo biloba and curcuminoids also have OPCs involved, and we also know that those two extracts from ginkgo biloba and curcuminoids can be very beneficial for health. So OPCs are very much recommended by me. So what do OPCs actually do? Well, they increase cell vitality, they increase vascular circulation, they decrease capillary fragility, in other words, they strengthen the capillaries, they increase resistance to bruising, they decrease the leakage of blood vessels, therefore they can decrease strokes. Most of these vascular effects take 2 to 8 weeks to have an effect. They can decrease macular degeneration, probably due to the increased vascular diffusion of oxygen in the retina. They can help with collagen or elastin disease processes, hence its effect on the vascular and joints and to trauma. They increase joint flexibility. So a combination of OPCs with other vitamins is the best due to the synergistic or potentiation effect between the components. Let me illustrate this. OPCs were discovered. When they discovered them, they didn't really know that they were OPCs, but they were discovered about 400 years ago when there was an explorer cruising up the St. Lawrence River. Half of the crew had died of scurvy, and scurvy is a vitamin C deficiency, and the other half of the crew was about ready to die. So they beached the craft, and a friendly Indian apparently took pity on them and invited them to have a remedy that he had concocted. And the concoction was he had boiled up a sort of a soup made out of pine needles. I hesitate to guess what it would have tasted like, but I guess beggars can't be choosers. So the crew ate this soup or drank it, and they recovered from scurvy. Now the point here is that they didn't increase their vitamin C content in their bodies, but the OPCs potentiated what was already existing in their bodies, and so the scurvy symptoms went. So that's just an illustration of the potentiation or synergistic effect of OPCs working with other vitamins. So here's some important points for you to consider. Firstly, prevention is always going to be better than cure. Secondly, supplementation of antioxidants does not work for everyone. By supplementing with antioxidants, you reduce the incidence or likelihood of getting a disease process, but it doesn't mean to say you will not get a disease process. But if you do get a disease process, the theory would be that you are likely to get a cure more easily, but that's not guaranteed. It takes normally 7 to 90 days to get a noticeable effect when you supplement with antioxidants. And you may feel a little unwell in the first 30 to 60 days while free radicals are being excreted from the body. Now, why is that so? Well, when you supplement with antioxidants, they attack the free radicals that are in your body, and the free radicals are deposited in the bloodstream. So ironically, when you take antioxidants, if you have a lot of free radicals in your body, you're going to have an increased free radical concentration in your bloodstream. So it makes you feel a little unwell for a while. But it's excreted, or those free radicals are excreted in the urine. So over a period of time, you'll actually end up much healthier. My advice would be that if you're taking antioxidant supplements and you're not feeling terribly well for a little while, continue taking them, because it's a very good indication that you've probably got a lot of free radical attack occurring in your body. So what diseases may be helped with OPCs? Atherosclerosis, that's heart disease like coronary artery disease and angina, but you've got to remember there's a 200-day lead-in time to get any effect. Prostatitis, probably only in benign enlargements. There's many people in the community, males obviously, who have prostate disease problems, and so it's always worth considering OPCs. Vascular problems can have dramatic results. Hemorrhoids may shrink. Leg ulcers, you can get up to a 95% reduction in leg ulcers. Varicose veins may reduce and improve. Swollen legs can reduce in size. And in fact, swelling anywhere in the peripheries can be reduced. So this is especially useful in trauma cases and pre-elective surgery. Phlebitis can be helped. For some reason, we're not sure why, but sometimes the tremors in Parkinson's can be reduced. This was particularly interesting when I had a client who had very bad Parkinson's tremors, and for some reason that I've never understood, he took OPCs and he got a dramatic improvement. Diabetes can be helped. You can stabilise blood sugar levels, and you might ask, why would that be? Well, we know that free radicals attack the pancreas and the insulin molecule, and so there's every chance that OPCs protect against the free radical attack in the pancreas and probably the insulin molecule. Retinopathy can be helped considerably, and what that means is that people with diabetes will often suffer blindness or reduced eyesight, and OPCs can help considerably there. And as I've indicated, insulin levels can be stabilised and lowered with those people who need to take insulin injections. Arthritis can be helped, so rheumatoid arthritis, osteoarthritis can be helped. Dermatitis, psoriasis, flaking skin and eczema. And of course you've got to remember to be careful with the free radicals that you're using in your personal care products with your dermatitis as well. Asthma and hay fever may be improved. It's amazing how asthma can be influenced by OPCs. Many people on long-standing Ventolin inhalers can reduce the amount of Ventolin they need, which is very useful because Ventolin can actually lead to cataracts forming. And so my advice would be, why not try OPCs and see if you can get a reduction in your asthma symptoms. Cancer, I don't really know. If I had cancer, I'd be taking OPCs, particularly during any therapy, because chemotherapy and radiotherapy are not well tolerated by the body, and OPCs can help tolerate more treatment. ADD, attention deficit disorder, can be helped with OPCs, and chronic fatigue syndrome can be helped considerably as well. But I've got to stress, all of this is very much an individual response. You really don't know how it will work until you give it a try. But I've got to stress that this is very much an individual response. But OPCs won't cause any harm, and if they work, they'll be very beneficial. So I'll urge you to give it a try. So the overall philosophy with antioxidant supplementation is, above all else, do no harm. And that philosophy is paramount when OPCs are used. They don't cause any harm, and time will tell whether they can help you. So what's next? What does this really mean for you? Well, this presentation is necessarily brief. I can give health seminars which last for hours, and believe me, you don't want to listen to them. So for more information, in particular about the various products that might be able to be used by you, ask the person who suggested that you review this presentation and get more details. Or go to the various websites that are available and review the information on those websites. Thank you very much for listening. I hope this information's been beneficial for you, and I hope if you want to prevent disease that you do take antioxidant supplementation.